Hi, I'm Domino Bucarelli. I'm a GP and I work here at Colleges Crossing in Carana Downs in Queensland, Australia. So as a GP, I'm lucky because I get a very wide variety of patients. So I never really know what my typical week is going to be. There isn't really a typical week in general practice because a lot of the times you don't really know what's going to come through the door. Even with your regular patients, sometimes they'll surprise you. So you always have to be on your toes a little bit. But that's one of the things that I really love about general practice, and that's why I do it. I completed all of my training here in Australia, went to the University of Queensland for my medical school, and went up to Townsville to do my internship. And then I was over in Perth for a little while, and I did some emergency training there, which was really good and very helpful for general practice as well, because again, you don't really know what's going to come through the emergency doors. And then I ended up actually in Victoria doing my GP registrar training, and then moved back up to Queensland with my husband. And now I'm here. So the best bit about being a GP for me is that I get to know my patients, so I know them on a more of a personal level than you'll get in, I think, a lot of other medical specialties, because you will see them regularly. You'll often see a lot of their family members as well, so you know what's going on behind the scenes a lot of the time, which can help formulate what you think might be going on with their particular problem of that, of that day that they're presenting. So that's definitely my favorite part about it. Oh yeah, so other good parts about general practice is, well, at least in Australia, if you work as a contractor, you can set your own schedule, essentially. It's always on discussion with your practice, and you're obviously mindful of the colleagues that you're working with. But you can decide, what days or how many sessions or how many people you want to see per day, per week, and tailor it sort of to your lifestyle. So maintaining a good work-life balance is probably easier in general practice than it might be in some of the other specialties, particularly if you're doing primarily hospital work. There's no shift work, and that's what killed ED for me, because I loved emergency, but the shift work just not sustainable for a happy life. So that's why I gave that up. But then in GP, you do very similar things to emergency department, where you don't know what's coming in and you've got to work the patient up, and just less of the, really acute things. The hardest part for me about general practice, that's a difficult question. I think on a patient level, when you don't really know what's going to come through your door, having to develop a plan of attack, if you will, for each particular condition that you might come across can be challenging, because you have to think really, really broadly about all possibilities when you're coming up with a plan. And you've got to think, first of all, is this particular problem something that could be very harmful to the patient, and I need to diagnose this quickly? Or is it something that I can have a little bit more time with, and it's not quite so urgent, but I don't really know what's going on yet? So I guess that would be dealing with uncertainty. When I'm not really sure what's going on, I can't give the patient an answer about what's happening, and I need to sort of reconcile that in myself. Well, I'm uncertain about what's going on. I can't give them a clear answer, but I've got to work through it. So learning to sit with that uncertainty has been very challenging. Yeah. being in practice, and the longer you're in practice, the easier it becomes, because you just see more conditions, and you just get naturally better at sitting with that uncertainty. For me, I have a bit of a drop box in my head for certain common conditions. So, and I can work through, all right, well, what's, likely to really harm this patient, and what are things that I don't want to miss, and then what else is on that particular list for differentials. And so then I just work through in my head, right, don't want to miss, and what else is on there. And then I'll usually have a workup plan in terms of what investigations I want to do for each particular condition. So that helps me deal with uncertainty, because I've essentially already got my plan in place for a lot of presentations that I'll have. And I find sharing the uncertainty with the person, with the patient. It's okay to say, I don't really know what's happening here, but either I don't think it's something very sinister, but these are the things that I want to look at, or I do think this could be something significant and we need to do these investigations quickly. And so you're sharing that uncertainty with the patient, so you're both sitting with it. And I think I've had feedback from patients where they've been very happy when I've said, I don't really know, but I'm gonna do my best to figure it out. And that really helps, because they know where your head is and everybody's on the same page. Yeah. What makes a good GP? I want to say being nice, because I think that's important, because being kind to other people immediately makes people more open to listening to what you have to say. If you are a grumpier individual by nature, that might make it a bit difficult for people to want to perhaps follow your advice. And I think that's just true of human nature. If you don't really want to listen to hostile people, because your back immediately gets up, and then we tend to shut down our listening when that happens. So I think being nice, and we always speak about empathy, and yeah, that's important, but that's something that can be faked, really. So I think at least if you can convey that you do understand perhaps what the person is going through, and take on board that whatever they're coming in with is important to them, whether or not you actually feel that inside, that's fine. But again, the conveyance of that is important. And I think you have to be pretty comfortable with uncertainty, like we were talking about before. If you were someone that needs to know what everything is right away, and you're not going to be comfortable not knowing something, then this probably isn't the specialty for you, because there's a lot of that. The good thing is you get people back and you can review them, and that helps with that. But if you are like, right, no, I need a whole team behind me, I need to have this done right away and this done right away, GP's not for you. So I think being able to sit with the uncertainty, being kind, and at least conveying empathy is important as a general practitioner. My top 3 tips for being a good GP would be, the first one's a bit twofold. 1, don't take your work home with you. Anything that happens in the office should stay in the office, and I'm talking about mostly emotional toll. And on that note, I give myself one thing to whine about that happened during that day if I need to. One thing only. Give myself 10 to 15 minutes, have a good whinge about it, that's it. But it has to be followed up with one good thing that happened during the day. So that's my number 1 tip. Second tip is to develop your jot down boxes in your head for commonly presenting conditions, because it makes your life a whole lot easier. You've got your plan in place already, and then it's a lot easier because you won't be feeling like you're uncertain about things, or unsure about what you're going to do. And then that conveys confidence to the patient as well. My number 3 tip is to be kind, even when you don't feel like being kind. And if you are really feeling grumpy that day, fake it, because it really, really helps. It really helps. So be kind to your patients, be kind to the people you work with. You can have a whinge about them later, that's fine, but only 15 minutes. And then something nice about them. So that's my top 3 tips.